Thank you, Mr. President. I rise this afternoon to talk about an important anniversary. This is 53 years, today I should say, marks 53 years since the Medicare and Medicaid programs were created, and I'll speak specifically today about Medicaid. Many Americans are familiar with all of the benefits that Medicaid provides to so many Americans, but I don't know if people have a sense of the scope of it. First of all, Medicaid helps 70 million individuals and families at every stage of life. Medicaid covers nearly half of every one of the births in the United States of America. Medicaid covers 40%, with health care, covers 40% of all children. That's all children across the country. It's also true in the Commonwealth of Pennsylvania. Roughly 40% of all the children in the Commonwealth of Pennsylvania are covered, have their health care through Medicaid. Roughly 50% of the people with disabilities in our state covered by Medicaid, and about 60% of those needing skilled care, so-called nursing home care. About 2 million Pennsylvanians covered by Medicaid. Medicaid is currently considered the, quote, gold standard for children's health care, including the early and periodic screening, diagnosis, and treatment benefits, known as EPS-DT for children. It doesn't get a lot of attention, but a lot of the professionals who understand pediatrics and children's health care will stress the importance of early and periodic screening, diagnosis, and treatment. Medicaid helps prevent moms and dads from being forced to decide whether or not to put food on the table or take a child to the doctor. Through Medicaid, 15 million people with disabilities receive assistance with their health care or with durable medical equipment, such as wheelchairs or assistive speaking devices, long-term supports for daily living, such as personal care attendants, and so many other benefits. If you just focus on the category of Americans with disabilities who are children, 60% of children in America with a disability are covered by Medicaid. Medicaid helps Americans afford their Medicare premiums, so that's the interplay between both the Medicaid program and the Medicare program. Medicaid pays for nursing home care for older relatives who otherwise would incur $75,000 per year of expenses that would force countless middle-class families out of their homes and would deprive them of hard-earned savings. How about our schools? 48% of school districts use Medicaid funds to provide medical and therapy services in schools for children receiving special education. Medicaid also funds transportation for eligible individuals to receive medical services. And finally, on this long list, Medicaid is the primary payer for opioid addiction, the treatment and services for the opioid addiction, as well as substance use disorder services. All of those issues are critically important to the American people, and especially, of course, the American family. That's why last year, and continuing into 2018, the efforts made to repeal the Affordable Care Act would have an adverse impact on Medicaid by, in one sense, decimating the program, badly injuring our ability to deliver all of those health care benefits to children, to people with disabilities, to seniors, and virtually in every bill that was considered in the Senate or the House, the effect on the opioid crisis would be devastating, because of what would happen to Medicaid expansion as opposed to the original Medicaid program itself. So I hope our Republican friends will consider all of those benefits and the impact on Medicaid when they're proposing repeal legislation and similar legislative proposals. I want to make a point about one family, which I think is, in so many ways is emblematic of a lot of other families when it comes to Medicaid. In Pennsylvania, I received a letter from a mom in southeastern Pennsylvania. Her name is Pam Simpson. She was writing to me about her son, Rowan. The impact on Rowan Simpson's life, like a lot of children's lives, is incomparable. It's hard to comprehend how beneficial it's been. As I said, his mom, Pam, sent me a note, and here's what she said in pertinent part. I won't read all of it, just excerpt part of it. She said, and I'm quoting, "In late January 2016, I applied for Medicaid assistance, medical assistance, I should say. That's the Medicaid program in Pennsylvania, medical assistance. After Rowan was awarded this assistance, we were able to obtain wraparound services, which included a behavioral health specialist, or behavioral health consultant, I should say, and a therapeutic staff support worker. The wraparound services have been a godsend," unquote. Then towards the end of the letter, Pam Simpson said, quote, "Without Medicaid, I'm confident that I could not work full-time to support our family. We would be bankrupt, or my son," meaning Rowan, "would go without the therapies he sincerely needs." She concludes the letter this way, Pam Simpson, quote, "Please think of my dear Rowan and his happy face, his big blue eyes, and his lovely strawberry blonde hair. Please think of me and my husband working every day to support our family. Please think of my 9-month-old daughter, Luna, who smiles and laughs at her brother daily. She will have to care for Rowan later in her life after we are gone. Overall, we are desperately in need of Rowan's medical assistance and would be devastated if we lost these benefits," unquote. That's one mom talking about her son in Pennsylvania, but of course representative of so many families across the country. We all know here, it's pretty evident from the data and where we're positioned in the world, that we are both the strongest country in the world, meaning the strongest economy, but also the strongest military power in the world. There's no question about that. But that same country, that same strong country, has figured out a way over time to take care of the American family, especially through a program like Medicaid. Hubert Humphrey said it well years ago, maybe even said this on the Senate floor when he was representing Minnesota. Hubert Humphrey said the moral test of a government is, quote, how it treats those in the dawn of life, those in the twilight of life, and those in the shadows of life. In a sense, talking about children in the dawn of life, those with disabilities and others who might be in the shadows of life, and those who are senior citizens in the twilight of their lives. No program touches more Americans than the Medicaid program. And we must continue to work to fight and keep Medicaid strong, not just for the next 50 or 53 because of today's anniversary, but for many years after that. Mr. President, I would yield the floor.